Imagine this. You feel the urge to go to the bathroom. You sit down, you push, you strain, but nothing comes out. And it's not just that nothing comes out, you feel this overwhelming pressure deep inside, like something is lodged in there and absolutely refuses to move. Maybe you've been sitting on that toilet for 20 minutes, 30 minutes, an hour. You feel bloated, uncomfortable, maybe even a little panicked. You're thinking, what is happening to my body right now? Why can't I go? Why does it feel like there's a rock sitting inside me? And the worst part? Some of you have been dealing with this silently for days. Days of discomfort, days of embarrassment, days of not wanting to tell anyone because, well, it's not exactly dinner table conversation, is it? Well, I'm here to change that, because this is a real medical condition. It is more common than you think, and if you ignore it, it can become genuinely dangerous. I'm Dr. Richard Ben, and today we are talking about something that most doctors rush through in a 5-minute appointment, but that deserves a real, honest, thorough conversation. We are talking about fecal impaction, stool that is literally stuck in your rectum, what it is, why it happens, how to recognize it, and most importantly, what you can do about it. So stay with me, because by the end of this video, you are going to have answers that could genuinely change your health and give you back your comfort and your confidence. Let's start at the very beginning, because I think to truly understand this problem, you need to understand what's happening in your body in the first place. Your large intestine, which we also call the colon, has one primary job when it comes to stool, and that is to absorb water as waste moves through it. Now, under normal healthy circumstances, stool moves through your colon at a reasonable pace, retains just enough moisture to stay soft and formed, and when it reaches the rectum, your body signals you to go, and everything comes out smoothly. But here's where things can go wrong. If stool sits in the colon or rectum for too long, for whatever reason, the colon keeps doing its job. It keeps pulling water out of that stool. And what do you get when you remove all the moisture from waste material? You get something hard, dense, almost rock-like. And that hardened mass can become so large and so compacted that your body simply cannot expel it on its own anymore. That, right there, is fecal impaction. Stool that has become so hardened and packed in your rectum or lower colon that normal straining and pushing cannot get it out. And I want you to understand something important here, because a lot of people confuse this with regular constipation. Yes, fecal impaction starts with constipation, but they are not the same thing. Regular constipation means your stools are hard, infrequent, or difficult to pass. That's uncomfortable, yes, but usually manageable. Fecal impaction is what happens when constipation goes unaddressed or is severe enough that a solid, immovable mass forms. It is the end stage of severe constipation, and it requires a different kind of attention entirely. You cannot just drink a glass of water and wait it out. You need to take action, and the right kind of action. Now let's talk about who this actually happens to, because I want to remove any shame around this conversation. Fecal impaction can happen to anyone, but there are certain groups of people who are significantly more vulnerable than others. Older adults are at the top of that list. As we age, the muscles of our digestive system naturally weaken. The contractions that push waste through the intestines, what we call peristalsis, become slower and less powerful. Combined with reduced physical activity, less fiber in the diet, and often multiple medications, older adults face a much higher risk. And speaking of medications, this is a huge one that I really want people to pay attention to. Certain medications are notorious for causing severe constipation that can lead to impaction. Opioid pain medications are probably the most well-known culprit. If you or someone you love takes opioids for chronic pain, for post-surgical recovery, or for any other reason, constipation management is not optional. It is absolutely essential, and I'll come back to this in a moment. But it's not just older adults and opioid users. People with neurological conditions like Parkinson's disease, multiple sclerosis, or spinal cord injuries often have impaired nerve signaling to the bowel, which means the normal urge to go may be dulled or absent. People who are bedridden or have very limited mobility are at risk because movement and activity are actually key drivers of bowel motility. People with eating disorders, particularly those who chronically misuse laxatives, can end up with a bowel that loses its natural ability to function properly. Even children can develop fecal impaction, often as a result of withholding stool due to fear of pain or anxiety. And then there's dehydration. If you are chronically underhydrated, your colon will compensate by pulling more water out of stool, making everything harder and more difficult to pass. So how do you know if this is happening to you or someone you care for? The symptoms of fecal impaction are something I want to walk through carefully, because some of them are obvious and some are surprisingly easy to miss or misinterpret. The most obvious symptom is the inability to have a normal bowel movement despite feeling the urge. You feel like you need to go, you may strain for a long time, and either nothing comes out or only small amounts of liquid or soft stool manage to squeeze around the impacted mass. And yes, I said liquid stool. This confuses a lot of people and even sometimes confuses physicians who aren't thinking carefully. What can happen is that liquid stool from higher up in the colon seeps around the hard, impacted mass and leaks out. This is called overflow diarrhea or paradoxical diarrhea, and it is one of the most misleading symptoms in medicine. People see liquid coming out and they think, well, it can't be constipation, can it? And they might even treat themselves for diarrhea, which makes everything worse. If someone is having watery leakage but feeling pressure and the sensation of incomplete evacuation, impaction should absolutely be on the radar. Beyond that, you might experience significant abdominal pain and cramping, particularly in the lower abdomen and around the rectal area. Bloating can be severe. Your abdomen may look visibly distended. You may feel nauseous, and in some cases, people actually vomit. You might experience a loss of appetite because your body is essentially saying there is no room for more input right now. Some people feel a constant sense of rectal pressure or fullness, almost like there is something sitting in their lower pelvis that won't move. In older adults or people with neurological conditions, confusion and agitation can actually be symptoms of fecal impaction. And that might sound strange, but when the body is under significant physiological stress, the brain can respond in unexpected ways. And in severe cases, if the impaction is putting significant pressure on the bladder, there can even be urinary problems. If you or someone you know is experiencing these symptoms, I want you to take them seriously. This is not something to push through and hope will resolve on its own. Untreated fecal impaction can lead to serious complications. The pressure from the impacted mass can cause something called stercoral ulceration. Essentially, the hard stool causes pressure sores and ulcers in the lining of the rectum or colon. In extreme cases, this can lead to perforation, a tear in the bowel wall, which is a surgical emergency. The impaction can also put significant pressure on blood vessels, affecting circulation. It can compress the urinary tract, and in severe, prolonged cases, it can even affect heart rate and blood pressure due to the stimulation of the vagus nerve. I'm not telling you this to scare you. I'm telling you this so you understand that this deserves real, prompt attention. So let's talk about what you can actually do. And I'm going to break this down into immediate relief measures, medical treatments, and then the longer-term prevention strategies that will help you make sure this never becomes your problem again. If you suspect you have mild fecal impaction or severe constipation that's heading in that direction, there are some things you can try at home first. The first and most accessible option is an over-the-counter enema. A standard sodium phosphate enema, the kind you can find at any pharmacy, can introduce fluid directly into the rectum, which helps soften the impacted stool and stimulates the bowel to contract and expel it. Follow the instructions carefully, lie on your left side if possible, and give it time to work. This approach works best for impactions that are low in the rectum and not too severely hardened. Glycerin suppositories are another option that works in a similar way. They introduce moisture and lubrication directly to the area where the stool is stuck and can help trigger the urge to go. Oral laxatives can help, but I want to be careful here because the type matters enormously. Osmotic laxatives, things like polyethylene glycol, which you might know by brand names like Miralax, work by drawing water into the colon, softening stool over time. These are generally well tolerated and effective for moderate constipation. Stimulant laxatives like bisacodyl or senna work by stimulating the muscles of the colon to contract. These can be helpful but should not be used long-term without medical guidance. And I want to strongly caution you, if you have a known or suspected impaction, taking large doses of stimulant laxatives hoping to force the issue can actually cause significant pain and may not be effective. Please do not go down the path of taking more and more laxatives without medical guidance. Hydration is always important, but I have to be honest with you. If a true impaction has formed, drinking more water alone is not going to dissolve it. It helps support overall bowel function and will be important in your recovery and prevention, but it is not a treatment for an established impaction. If home measures don't work within a day, or if your symptoms are severe, including significant pain, nausea, vomiting, rectal bleeding, or if you feel genuinely unwell, please do not wait. See a healthcare provider. When fecal impaction is diagnosed, the primary medical treatment is something called manual disimpaction. I know that sounds alarming, but let me explain. A healthcare provider, after appropriate lubrication and with gloved hands, manually breaks up and removes the hardened stool from the rectum. This is the most definitive and immediate treatment for rectal impaction, and while it is not the most comfortable procedure, it provides relief that no amount of waiting or laxatives can match when the impaction is severe. It is a routine procedure for trained healthcare providers, and you should not feel any embarrassment about needing or requesting it. Following manual disimpaction, providers will often administer enemas to clear out remaining stool and may recommend a regimen of oral laxatives for several days afterward to ensure the bowel is fully cleared and to reestablish regular function. In cases where the impaction is higher up in the colon rather than in the rectum, manual disimpaction may not be possible, and higher volume enemas or colonoscopic assistance may be needed. These are less common scenarios but worth knowing about. Now I want to spend real time on prevention, because this is where I can genuinely change things for you. Once you've experienced fecal impaction, or even if you haven't but you recognize yourself in the risk factors I described, prevention is not optional. It is a daily commitment. Fiber is the foundation. Dietary fiber, particularly soluble fiber, absorbs water and forms a gel-like consistency in your intestines that keeps stool soft and moving. Adults need roughly 25 to 38 grams of fiber per day, depending on age and sex, and the vast majority of people get nowhere near that amount. I want you to start thinking about fiber-rich foods as medicinal. Fruits like prunes, pears, and apples. Vegetables like broccoli, carrots, and leafy greens. Legumes, beans, lentils, chickpeas are some of the most fiber-dense foods available. Whole grains instead of refined grains. These are not just healthy eating suggestions. For someone managing bowel health, these are strategic, important choices. Water. You need to drink enough of it. Fiber without adequate hydration can actually make constipation worse because fiber needs water to do its job properly. A general guideline is around 8 glasses of water per day, but this varies based on your body size, activity level, climate, and medications. If your urine is pale yellow, you're probably well hydrated. If it's dark yellow, drink more water. Physical activity is more important for bowel health than most people realize. Movement stimulates peristalsis, the wave-like contractions that move waste through your intestines. Even a daily 30-minute walk can make a meaningful difference in bowel regularity. For people who are less mobile, even gentle movement, changing positions regularly, or seated exercises can help. Don't ignore the urge to go. This sounds simple, but it's incredibly common for people to suppress the urge because they're busy, because they're somewhere unfamiliar, or because they have pain or anxiety around defecation. When you ignore the urge repeatedly, stool sits in the rectum longer, more water is absorbed, it becomes harder, and the urge signal can actually become weaker over time. When your body tells you it's time, try to respond. Create a routine if you can. Many people find that regular, relaxed time in the bathroom in the morning, perhaps after breakfast when the gastrocolic reflex naturally stimulates bowel activity, helps establish a reliable pattern. For people on opioid pain medications, bowel management is something that needs to happen from day one of starting that medication. It is not something you deal with if constipation happens. Opioids slow bowel motility as a predictable, unavoidable side effect, and a bowel regimen including stool softeners and laxatives should be prescribed alongside them. If you are taking opioids and your bowel regimen isn't working, talk to your prescribing physician. There are even medications specifically designed to address opioid-induced constipation, and you deserve access to them if you need them. For older adults especially, I want to emphasize that bowel health deserves the same ongoing attention as blood pressure, blood sugar, and all the other things we routinely monitor and manage. It is not trivial. It is not embarrassing. It is a core part of quality of life, and healthcare providers should be asking about it at every visit. Before I wrap up, I want to address one more thing: the emotional and psychological component of this. I know this is a topic that people feel deeply uncomfortable discussing. There is a cultural taboo around anything related to bowel function, and that taboo has real consequences. People wait too long to seek help. People suffer in silence. People feel ashamed of something that is, at its core, a medical condition entirely beyond their control. I want you to hear me clearly when I say this. If you are dealing with this, you have absolutely nothing to be ashamed of. Your bowel health is part of your overall health. Full stop. Your comfort, your dignity, and your quality of life matter. And the moment you decide to take this seriously, to talk to a healthcare provider, to make the changes that support your bowel health, that is a moment of strength, not weakness. So let me quickly summarize what we covered today. Fecal impaction is hardened, compacted stool stuck in the rectum that cannot be expelled with normal effort. It's different from regular constipation and requires specific treatment. It can affect anyone, but the highest risk groups include older adults, people on opioid medications, individuals with neurological conditions, and those with limited mobility. Symptoms include inability to pass stool, straining without results, liquid leakage around the impaction, abdominal pain and bloating, nausea, and rectal pressure. Complications if untreated can be serious, including bowel ulceration and perforation. Home management starts with enemas and appropriate laxatives, but medical care, including manual disimpaction if necessary, should be sought promptly for severe cases. And prevention through consistent fiber intake, adequate hydration, regular physical activity, not ignoring the urge to go, and active bowel management if you're on high-risk medications is absolutely achievable and life-changing. I'm Dr. Richard Ben, and I make these videos because I believe that clear, honest medical information, delivered with respect and without judgment, can genuinely help people live better, healthier, more comfortable lives. If this video helped you, if it answered a question you were too embarrassed to ask somewhere else, if it gave you the confidence to have a conversation with your doctor that you've been putting off, then it did exactly what it was meant to do. Now, before you go, I want to ask you something. And I genuinely mean this. This is not just something I'm saying to fill time. I want you to drop a comment below and tell me two things. First, tell me where in the world you are watching this video from. What city, what country, just let me know. And second, tell me whether you or someone you love has ever dealt with this problem. Whether it's chronic constipation, fecal impaction, or just that uncomfortable feeling that something isn't quite right down there. Tell me your experience. You don't have to share details, just let me know. Say, I've been through this, or this is happening to me right now, or I'm watching because I'm worried about someone I care about. Whatever feels right for you. The reason I ask is because this matters to me deeply. When you leave a comment, I personally read it, every single one. And when I see that someone in Pakistan is dealing with this, or someone in the UK, or someone in the United States, or Canada, or Australia, or South Africa, it tells me something important. It tells me that this is a global problem. It tells me that people everywhere, regardless of culture or background or healthcare access, are sitting with this discomfort and searching for answers. And it tells me exactly who my community is and what you need from me. Your comment helps me understand which topics to cover next, which questions to answer, and how I can serve you better as your doctor on this channel. So please, do not scroll past without leaving something below. Even just your country name and one word about how you're feeling. That means the world to me. And if this video helped you, please share it. Share it with a family member, share it with a friend, share it in a group chat. Because I promise you, there is someone in your life who is dealing with this silently and doesn't know where to turn. Your share could be the reason they finally get the help they need. Give this video a thumbs up if you learned something today. And if you haven't subscribed yet, hit that subscribe button right now and turn on the notification bell. Because I release new health videos regularly, and every single one is made with the same commitment to giving you real, honest, medically accurate information without judgment and without shame. Take care of yourselves, every part of yourselves, and I will see you in the next one.